I understand that we are joined by Dr David Bull now, Deputy Leader of Reform UK and indeed a GP as well. And we're going to just stick with this issue of vaccine passports, actually, Dr David. So, do you believe the government now, or at least Sajid Javid, when he's saying that, actually, hang on a minute, we might not be having these vaccine passports, do you think they ever wanted to bring them in the first place?
No, I don't believe a word the government says, to be quite honest. You know, for a long time I've been saying this is completely illogical, it's unnecessary, it's misleading and it's highly discriminatory. And so finally, I think the government has realised that actually there is a tide of public opinion against them. Clearly what happened with national insurance and the rise in that and the backlash that that triggered has made the government realise they've lost 8 percentage points in terms of the polling. You're seeing parties like mine now at historic highs, and I think the government is frightened. But make no mistake, this has not gone away. The Public Health Act remains on the statute book, which means that the government can do whatever it likes going forward. And secondly, they haven't shelved vaccine passports, they've merely postponed them.
Is there a case for vaccine passports in health settings? I think from November or so, people working in social care will have to be, well, it's a vaccine passport of one type, I suppose, will have to show their double jab to work there.
Yeah, I mean, let's just look at the science here. So the whole point about the vaccination programme, and it's worth saying, the UK's vaccination programme has been extraordinary, and well done to everyone who's been involved in that. And what we know now is we've got masses of people, 90% who've been vaccinated. We know, however, that having the vaccine doesn't stop you getting COVID and it doesn't stop you transmitting COVID. But what it does do is it breaks the link and it stops you becoming seriously ill or hospitalised. And that's really important. So the point about vaccine passports originally was to say, well, look, if you've had the vaccine, you can prove you've had the vaccine and therefore you're immune. Well, that is no longer the case. So therefore, having a vaccine passport that says you've had the vaccine doesn't mean anything because, of course, it still means that you can have COVID. I think it's highly discriminatory, too, because there are lots of people who object on moral grounds or medical reasons. And, of course, in the UK, we don't believe in compulsory vaccination anyway. That being said, in terms of your question going back to the healthcare setting, I do think that all healthcare workers should be vaccinated. I think it's only right and proper. In healthcare settings, you have the most clinically vulnerable, the elderly, and those people with chronic illnesses, and they need as much protection as possible. And for those libertarians who are saying, well, actually, you know, that's not acceptable, I have to say, as a medic, we have to have hepatitis B to work in a hospital. There is no difference to me between being immunised against hepatitis B and immunised against coronavirus. So in terms of healthcare setting, yes, I completely agree. In terms of vaccinating the wider population, I have a major issue with vaccinating 12 to 15-year-olds. I think, to be honest, it is totally unacceptable that we're trying to vaccinate children against a disease which doesn't cause them serious harm to protect older people. I think it's unethical.
OK, well, I just want to put a question directly from our viewer to you. Ian's been in touch. He says, if I hear the word U-turn one more time, I'll turn off. A lot of people are saying this isn't a government U-turn on vaccine passports. This is shifting with an ever-changing agenda. What's your view?
Absolute nonsense. What this government does is, if you notice, they announce something and gauge public opinion. When they realise that actually it hasn't gone down very well, they then ditch the policy. So, yes, it is another U-turn. I do agree that this is an unfolding situation, but doctors like me have been warning for a very long time that actually the government's policy was wrong and it was misguided. Let's take another example, for example, with the vaccination of younger people. The JCVI have come out and said, actually, there is no case for young people to be vaccinated. Well, the government didn't really like that. So then they've gone off to the chief medical officers of all the nations and said, you need to look at this in the broader context, which means actually you need to approve it. And as far as I'm aware, they're going to start rolling out a single vaccine dose as early as next month or even earlier than that. So the point is that the government seems to be completely out of control. It does what it wants and it is corrupting the public. It's pushing the public to agree with it. And my biggest worry about this vaccine passport is many of my friends and sources in government have said there is another lockdown on the way. And I think that what they might try and do is to say, OK, we'll introduce vaccine passports and then stop a further lockdown. So I don't believe a word the government says.
Well, Dr. David Bull, appreciate your time this morning. I think we all really very much don't want another lockdown. Now joining us to speak about the Scottish angle, Professor Hugh Pennington, Emeritus Microbiologist at the University of Aberdeen. Thank you for joining us. Why do you think the Scottish government has decided to go forward with the vaccine passports, but the UK government, England haven't?
Well, I mean, the very recent U-turn by the government in Westminster, it sort of mirrored what happened in Scotland, because both the senior members of the SNP and of the Greens were against vaccine passports. Then suddenly they're in favour of them. And, you know, this is all about politics, isn't it, really? Because there is a virological case for having vaccine passports. On the one hand, it does reduce the risk of getting infected, and it reduces the risk that people might pass the infection on in crowded places like nightclubs. It reduces the risk. It doesn't eliminate it, it reduces it. And also, it acts as a kind of cosh to beat the unvaccinated who have deliberately not got themselves vaccinated to get vaccinated, so they can go to a nightclub. And that was one of the aims of the exercise. And it's still the aim in Scotland, I think, to try and get as many people, not people who are going to suffer from the virus in terms of being hospitalised, but who could pass the virus on to other people who might be. So that's the policy. And so there have been U-turns in Scotland as well as in England, which I think proves my point that really this is more about politics at the end of the day than it is about the science. The science is quite reasonable, but it's not the answer to the problem. And of course, in Scotland, we've got very high levels of virus. We have had for the last 10 days or so, since our schools went back earlier in England. And who knows what's going to happen, down in England, because clearly, there's a gap in terms of the schools going back down in England as compared to Scotland. So, and of course, at the end of the day, the governments, whether they're Westminster or Holyrood or Cardiff or anywhere else, are in the hands of the virus, and the virus is a very cunning beast, and that's giving all the policymakers problems, because there are no, I think there's this good quote I like, which is, for every complicated problem, there's a simple answer, and it's wrong. So this has caught out people, and it will continue to cut people out, I think, until we get, I think one good aim that we've really been very, very efficient at is getting as many people vaccinated as possible. The more people we have vaccinated in the population, the harder the virus is to continue.
I get that, absolutely. But in terms of the vaccine passport issue, surely isn't that just a document that shows, if we get down to brass tacks on it, that whilst it might take the edge off the coronavirus, you can still contract it and you can still pass it on. So why wouldn't it be better to just test people on the way into venues? What is this obsession with vaccine passports all about?
Well, I suppose it's easier in the sense that you just to have something on your smartphone that says, yes, you've been vaccinated and you're now immune, because there clearly would have to be a gap between the last dose and you being able to go in, so that you've developed immunity. Of course, it doesn't prove that you have developed immunity. Most people will have done. Not everybody, 99% will have done, but there's the odd one, people who don't make a very good response. The testing, of course, if it's lateral flow, that misses cases and so on. And, it's a bit of a toss-up really between the two. And so basically, the problem with this virus, which hasn't really had as much emphasis as I would like to see, is that it specializes in causing super spreader events where one person can infect a very large number of people. Most infected people don't infect anybody at all. The trouble is, we've got no simple way of finding out which is which. And so that's complicated. It's not like flu. It doesn't happen with flu like that. It happens with COVID. And it's happened in the past. And one of the reasons why nightclubs have been targeted is there have been problems in nightclubs last year, particularly in countries like South Korea and so on. Big events where people have a lot of heavy breathing as part of the event is a very good place for the virus to get about. And I think that's driven the policy. But of course, once we get the virus levels down to reasonably low levels, it doesn't go away, but it goes away as a serious risk. And we're not there yet, unfortunately.
Dr. Hugh, thank you very much. Dr. Hugh Pennington.